Good day, everyone. I'd like to welcome you to this episode of the System Podcast. And today we'll be talking about phantom pregnancy, a journey into the mind. Okay, I'll start by the introduction. Phantom pregnancy or pseudosis cases is a psychological phenomenon which helps to justify the mind-body connection. And the mind-body connection is something which have been there, like talking about the concept of meditation is just trying to help you to be able to control your mind properly, for you to be able to use it to control your body. Now, phantom is a fancy word which means ghost, something which is perceived to be there but not actually there. And pseudo cases is from the Greek word pseudos, meaning false, and cases meaning pregnancy. Okay, now the main reason of talking about this topic, for me personally, it's kind of personal because I do love everything psychiatry, psychology, the brain itself. So now in this episode, I'm willing to explore the mind-body connection and the power of the mind to control and influence the body. So, and we are kind of using phantom pregnancy as a kind of the background for explaining this concept. But along the way, we'll bring up other examples. Let's describe what phantom pregnancy is or pseudo cases. It occurs in a woman who desperately wants to be pregnant, and occasionally some who deeply dread pregnancy. They develop all the signs and symptoms of true pregnancy. Their abdomen swell to enormous proportions, aided by a swayback posture and the mysterious deposition of abdominal fat. Their nipples become pigmented, as seen in pregnant women. They stop menstruating, lactate, that is, their breasts become filled, they have morning sickness and sense fetal movements. Everything seems normal except that there is no baby, and that means there is no fetal heart sound if an examination is done. So the presentation of this patient, like how do they normally present, or how will they be? Will you see them? Now they are delusional. As we started, we said is something that happened in the brain, like the mind. So it's a form of delusion. So, and after that delusion, they also have the symptoms of the pica. This is just the cravings which pregnant women have on things which are hard to get, and enlargement of uterus and cervix can be seen. But however, there is negative ultrasound scan, and they are mostly depressed because, as we said earlier, these are women who are desperately in need of children. And as we go further, you come to see how culture influences it, and why it's little in this time and it's more in the past. Because in the past there is kind of like a cultural trend that push the notion of having children. Why now we are facing the reverse, where everyone is promoting the concept of family planning. So, and there is child obsession. The first documented monograph on this condition was in 1930. It was by Dr. Silas Michel, the same physician who coined the word phantom limb. So he was the person that first documented it, and he named it the phantom pregnancy pseudo cases. Now let's talk about Mary Knight. She is a 32 years old woman. She walked up to Dr. Monroe's office. She was 9 months pregnant, and so far everything seemed to be going well. It was a long-awaited, much-desired pregnancy, but it was also her first visit to Dr. Monroe. This incident happened in 1932. Mary had only talked to a midwife before seeing Dr. Monroe, and the midwife was just across her street. So I guess not much examination have been done there. So the day she met Dr. Monroe was different. Mary had felt the baby kicking for some time and suspected that labor was about to begin. So when he examined her, he found her abdomen to be vastly enlarged and low, suggesting that the fetus had dropped. Her breasts were swollen, the nipples mottled, but the stethoscope was not picking a clear fetal heart sound. With the above, Dr. Monroe knows she is suffering from pseudocases or phantom pregnancy, because Dr. Monroe have learned this concept in medical school, but however, it's very rare, so he has not really come across much. So, but what struck him is how could he explain this to a woman who is desperately in need of pregnancy and she's delusional. So he had to give her an anesthesia, telling her that he wants to calm down the pain and all those kind of things. So when she woke up, he had to just tell her a false statement that there was a sudden stillbirth that she had, and they lost the baby. So the woman accepted it, and all the symptoms left, and the pregnancy subsided. And she went back home. After a week, she came back and met the doctor and told him that with all the symptoms, they have all come back as if she is pregnant again. She told the doctor that he has forgot to deliver her twins. So this is scary. I mean, if you listen to the story from the beginning, it seems as if she's pregnant, but this is not pregnancy, it's just a delusion. Now, what is the science behind the phantom pregnancy? Modern physicians have their own assumptions, and what they have is that from this concept results from a pituitary or ovarian tumor that causes hormones to be released, mimicking the signs of pregnancy. Now, we all know what the pituitary gland stands for, like especially anterior pituitary gland, which secretes the follicle-stimulating hormone, and luteinizing hormone, the ovarian, the ovary, which secretes the estrogen and progesterone. The estrogen is what really, the estrogen and progesterone, they matter a lot in the concept of pregnancy. So those doctors, they said there's tiny, clinically undetectable adenomas of the pituitary, which could be the explanation for this. And they said these particular things could suppress ovulation and menstruation and leads to other symptoms. We know for menstruation to occur, there has to be estrogen, and the estrogen will build up the endometrial lining, and later on, if there's ovulation, progesterone will be formed. So the thing here is that they said tiny tumor. So those tiny tumor, what most likely they will be doing, if it's in the ovary, they will cause for some particular period of time, cause a blockage of the release of the estrogen, and there will be no menstruation, there will be no ovulation, and also in the brain it can cause the blockage of the release of the gonadotropins, which is the follicle stimulating hormone and luteinizing hormone. So, and it can bring up the symptom. But if it was true, why is the condition sometimes reversible? That is the question. That this is where, because tumor is meant to be progressive, but why is it reversible, and why is it so much like it mimics the way pregnancy is so much to the extent that you can't distinguish it. So this cannot really explain it completely. So what causes it now? Cultural factors play a big role in this condition. And we could say cultural factor is one of the big thing that matters here. There is decreased incidence in this time, in our time, like the 21st century, of this condition. But if you go back in time in 1700, there is high incidence to the extent of 1 in 200 pregnancies, while in around 1998 there is almost 1 in 10,000 pregnancy. So you could see the disparity here. Now, and if you relate to that time there is excessive need of pregnancy. Like the culture then is towards giving birth, becoming pregnant. Like the pressure on women to give birth is more, while now it's kind of little. Things are changing. And also due to lack of ultrasound scans, so technology too, because of lack of much technology, then you would hardly be able to objectively say this is it. If there's that objectivity of ultrasound shown to a human, there will be less delusion. But where there is no much technology, then this stuff is meant to be increasing. So, but what causes the actual physical changes? This is where our problem is. According to few studies carried out on curious afflicted according to few studies carried out between the mind and body, that's the mind-body interaction, abdominal swelling itself is usually caused by a combination of 5 factors. The first is accumulation of intestinal gas, lowering of the diaphragm, and then a passage forward, like the pushing forward of the pelvic vertebrae, Then a dynamic growth of greater omentum. We know what greater omentum is, just like the apron sheet, which is front of the abdomen. If you open the abdomen, it's look kind of yellowish, or let me see. Actual uterine enlargement does occur in rare conditions. So an hypothalamus may go away, producing profound hormonal shifts that mimic nearly all the signs of pregnancy. Now you have to take note that the body's effort on the mind are just as profound as the mind on the body. Given the rise of a complex feedback loops involved in this forced pregnancy kind of a thing, the phantom pregnancy. Okay, and also we have to also consider the psychological phenomenon of the classical parent conditioning, whereby someone is kind of like goal oriented, whereby it's relating every event to a kind of a goal. For example, based on the idea that a woman feels the changes they have is as a result of pregnancy because they desperately need pregnancy. More of like we can have another way to explain this concept, like kind of say a person desperately he's after a girl or a person. Anyway, he sees the girl, you feel like this girl is here for him, or maybe anyone he sees it, he will kind of be relating the person to the girl without waiting to see clearly if she's the person. Now, so much for abdominal swelling. What about the breast and nipple and other changes? So it's another thing that we have to find a way to explain. Above, we've talked about the abdominal enlargement and all those kind of things. It can be the intense longing for a child, and associated depression might reduce level of dopamine and norepinephrine, which are the joy transmitter in the brain. This in turn reduce production of follicle stimulating hormone. Follicle stimulating hormone is just a fancy term to tell you that this is the chemical which is released from the anterior pituitary gland, which we said which is sitting in the brain. When it's released in the body, it is sending signal to the ovaries to produce follicles, which contains the eggs, which grow up and rupture and release the egg, which mixes with the sperm to create an embryo, and which becomes a baby. So low levels of this hormone could lead to elevation of the levels of prolactin. And when there's low level of this hormone could lead to elevation of the level of prolactin. We actually know what prolactin does. It makes the breast get bigger, and milk start getting produced in preparation for the coming baby. Now, this notion is in tandem with the phenomenon which is observed in those people who has depression, like excessive depression. They don't normally menstruate. Why? Because they won't be eating and all those kind of things. So there will be diversion of blood from irrelevant organs like though I'm not saying they are completely irrelevant, the uterus, but there would be diversion of blood to more important organs like the brain and other part of the body. So there will be no menstruation. No matter what the explanation can be, phantom pregnancy provides a valuable opportunity for exploring the mysteries, no man's land between mind and body. So, it's kind of a mystery which people don't really want to study. Science is just all about going to all these kind of boring things to study. But the actual reality is that this is what the world is moving through. Like, everyone wants to meditate. Everyone wants to know how some of these things relate to us. But people don't really go to lab to do research on all these things. They do research on what our ancestors have been doing, on and on and on. So if you look at this now, the concept of phantom pregnancy will give a green light, will give a push to tell us that, okay, let's try to go into this field. Let's try to search more. Let's try to be curious now. Implications to the mind-body connections. Some of the implications, like pseudokinesis, is dramatic but not isolated. Okay, so let's talk about other implications, other things that implicate the mind-body connection. And the concept of hypnosis is similar, but if you check it, in time should have some implication in medicine. It has some implication in medicine, but it's yet to be put as a rule as far as I know. Now, there are documented cases where you get hypnotized and warts disappear in a few days. But if it is true, why not on cervical cancer, since both of the conditions are caused by human papilloma virus, different variant of them? Or is it that the one causing cervical cancer is more dangerous also? Like, why not on cervical cancer? That is something to ask about. Okay, assuming it is true, how can someone think away a tumor? That is the question. How can you sit down and say, okay, I'm feeling this now. I want to just put my head on the couch, and even common headache. How can I think away headache out of my brain? That is something to look at. Okay, now, if it is possible, the possible ways that this can happen can involve autonomic nervous system. The autonomic nervous system, from the word autonomic, it controls automatic things in our body, like the control of our blood pressure, like some of the hair in your body, like when you feel cold, the way they react, and every other thing that is automatic. Now, it is possible, if it is possible now, that the mind could literally asphyxiate, sorry for my pronunciation, asphyxiate the words. So because this is a kind of a logical way that it can happen, asphyxiate the words by constricting blood vessels in its immediate vicinity, making it shrivel up and wither away. So it implies an unexpected degree of precise control by the autonomic nervous system, and also implies that the hypnotic suggestions can be understood and transferred to the region of the Watu. Things that have to happen is that the hypnosis can be understood by the autonomic nervous system and be directed to the right direction, because the finding is that they would see the Wats in a particular place and they will hypnotize the people, and the Wats in one particular place will go. But why not in everywhere? And why not cervical cancer? So this is not really clear. We don't really know the full mechanism. The second possibility is the hypnotic suggestion somewhat kickstarts the immune system, thereby eliminating the virus. Now it will kickstart the immune system to a very higher level. That's what they will mean, because definitely we have immune system is working 24/7 on everything that is coming into your body. But for it to, like, immune system to concentrate in a particular place and fight it rigorously and pull it down, like via hypnosis, so there has to be like a way which it will recognize it, understand it, and set it to that direction. So how? So it's still not really clear. So another example that you have to take note of here is it involves the interplay between the immune system and perceptual cues from the world around us. We are told that asthmatic attack could occur by merely seeing a trigger, for example, like a rose flower. But how does it actually happen? That's the question. Like, what is the basis behind it? How does it goes and make the constriction in the bronchioles? It's kind of vague. Okay, but let's believe it's true, and let's go with that. Now, if it's true, why can't we treat diseases too by conditioning, like associating bronchodilators with sunflowers? Kind of like give someone bronchodilators repeatedly while showing him a sunflower. Why can't we do that? Since our brain can literally use cue to become like triggered. So why can't we do that for drugs? So it's not really clear, but we still have to go to the lab and see and study and get to know how some of these things really play a big role in our life, and do all those kind of things. Now, the cultural perspective to this concept, if you depending on which culture you are, the Nigerian culture will definitely relate this to the concept of juju, or let me say spiritual stuff. But here in science, we don't really talk about spiritual stuff. There can be some spiritual aspect to it, but we don't really know for sure. We are kind of looking for what relates to what, kind of like mapping out the mechanism between things. That is what science do, and if we can really find the mechanism between. We don't really we keep on searching, we remain curious. That's what we do in science. And another way which culture can relate to this concept of mind and body is the way culture really, like, if you look at how our culture is changing our minds, what we perceive as right, what we fight for, what we strive for. Like, it's more of like a kind of like wireless control from the community. So more of like this, what we said about 1700, when there is excessive need of pregnancy, like there's pressure on the women to get pregnant, to repeatedly their mind will push them to feel as if they are pregnant, to seem to hear other things to come into this mind-body stuff of a thing. So it's a wild field. We need to go deep in, and we need to really explore and get the best out of it. In conclusion, I like to say that the moral of this discussion is not that we should have blind faith and believe in cultures, blindly follow everything we see, like the mind-body stuff, the meditation, just blindly. The most important thing is that we should bring these things to lab, do a control research on it, see things, what is happening. Let me give example, like the concept of the multiple multiple functional disorder. Yeah, multiple functional disorder, or if I'm mistaking it, is let me just describe it as a kind of person. Okay, multiple personality disorder, MPD. Yeah, multiple personality disorder is something which is real psychiatrists are trying to like kind of treat. So you see somebody is like this today, like this tomorrow. So let's bring other things to the lab to watch, to see how does it really work, so that we can leverage this in medicine. Is very important. I like you to also go into the book of The Phantom in the Brain book. Is a very great book by V.S. Ramachandran, a great neuroscientist, a great neurosurgeon. This is one of the best books I have read lately. So I would like you to read it too, because this discussion is based on a chapter in the book which talked about the concept of phantom pregnancy pseudo cases. There is more things you can see from the book. Thank you very much for listening. I'd like you to subscribe, hit the like button, and share with your friends, so that it can help the YouTube algorithm to help people get to know us. Bye.